alterations in retrobulbar hemodynamics after decompression surgery for inactive thyroid eye disease patients, moderate to severe thyroid eye disease patients. So a disclaimer, this article of my thesis has already been published in Eye last year. So we know in inactive thyroid eye disease, there is decrease in the blood flow. Active disease has inflammation and increased blood flow, and inactive disease has decreased blood flow, which can lead to ischemia at the optic nerve head and lead to ischemic kind of dysthyroid optic neuropathy, which is different from the compressive optic neuropathy. So we measured the blood flow in the central retinal artery and the ophthalmic artery using color Doppler imaging, and we calculated the resistivity index as shown in the formula. So the literature does not show any details about what happens with orbital decompression surgery in inactive patients. So we studied that using color Doppler. This was my study pattern. We had 3 groups. One group who needed surgery, who were ready for surgery. Second group, similar patients who did not consent for surgery. And third group were healthy controls with refractive errors and no other orbital disorders. And we excluded all systemic disorders and smokers who would have some vascular compromise. These are the demographics of my study. So we included 24 patients, and these are the pre-op and the post-op photographs where we can see that post-decompression, the edema has reduced, and in the left side images, we can see the proptosis has reduced. Now coming to the parameters, proptosis definitely reduced significantly, intraocular pressures, they reduced. Central retinal artery, velocities increased and resistance decreased, same with ophthalmic artery, and all these changes were significant before and after surgery. And these are the images of the color Doppler which we saw, where you can see the pre-op and the post-op, the waveforms of the velocity on color Doppler, they have significantly increased in each of the arteries. The group B, where there was no surgical intervention done, who were just observed for 3 months, there was no significant change in Doppler flow, which suggests natural course of disease. Over 3 months, the blood flow did not change, it remained low. And when compared with the normal controls, the thyroid group had significantly reduced perfusion indices. So using this, we made area under curve analysis. And when we compared the healthy with the thyroid orbits, we found that ophthalmic artery parameters, they had very high area under curve, almost 0.9, and we could establish some cutoffs, and we could also establish cutoffs to determine the severity of the disease. So what new this study adds is orbital decompression, it relieves the space volume conflict in the orbit in thyroid eye disease. But we hereby prove that it also improves the orbital perfusion in the central retinal artery and the ophthalmic artery. Thus, it will prevent the ischemia in the orbit and subsequent optic neuropathy in predisposed patients. Like orbital perfusion has already a proven role in normal tension glaucoma, and recently in POAG and PACG, we hereby prove the role in thyroid eye disease as well. We could establish cutoffs to distinguish between a healthy and a thyroid orbit, and also to determine the severity of thyroid orbits. So this could add as an adjunct to the CAS scoring which we use right now. And so these were the places where our gates were placed, and how any lesion distal would have affected the end diastolic velocity, and any lesion proximal would have affected the peak systolic velocity. And these are the main sites of resistance: the intraocular microvasculature, the compression at the orbit, and the muscles. So we can't actually do anything about the first two. We could relieve the direct compression of the vessels at the orbit using a decompression surgery, and thus we can reduce the resistance and improve the perfusion. Thank you.
Just one question I have to ask. Now you are just did you have that cutoff, and did you see in which type of thyroid eye disease, like mild, moderate, did any difference? Or just you have taken only those cases who are undergoing the surgery, decompression surgery?
Ma'am, we took inactive patients for more than 6 months who were inactive and who did not respond to steroids, and those were our moderate to severe patients. And the patients who did not undergo surgery, they were mild, or the patients who underwent surgery and the other eye was classified as mild. And using those findings, we classified.
And what about the active group?
Active group we did not take because there are very few indications for surgery in active, like dysthyroid compressive neuropathy or exposure keratopathy, and those could independently affect the perfusion because of inflammation. And smokers also we excluded
No,
all of them.
because we don't have a baseline, so you should have seen in all along with the normal case
Ma'am,
also.
those could have been potential
Yeah.
confounders in our statistical analysis.
Yes.
So we studied only the inactive group of
Okay.
thyroid eye disease patients. Sir, between the groups A and B, who underwent surgery and who did not, they were age matched and gender matched groups. So any confounding effect of the age was removed using that.
So you were saying it is inactive cases you have taken.
Yes, ma'am.
So what were your indications for surgery in those cases?
Ma'am, either the patients wanted cosmesis because one of their eye was proptosed, that was cosmetic decompression was one, and second, who did not have any clinical drop in vision, but they had reduced contrast, they had reduced color vision, reduced field of vision with normal IOPs and a normal healthy looking disc and macula. There we offered them the option because studies have shown reduced perfusion to the optic nerve head, but no study shows orbital decompression and any changes. So those patients we had been following up for 1 or 2 years at our center before we enrolled them for the study, and post that we have a 1 to 1.5 year follow-up right now, and they are clinically happy that they are able to appreciate, they are able to drive better, and that's what. We had 3 patients like that, so they could have been a subclinical optic neuropathy because we did not use VEP in this to correlate. We could have used that latency and amplitude could have changed in those patients, but they did not progress. Their quality of vision was maintained before and after the surgery, and they were happy. So that is a potential indication that ocular perfusion biomarkers using color Doppler, it could act as an adjunct. Like we could quantitatively determine where the thyroid eye disease is instead of our qualitative assessment on clinical basis. Like how visual fields have helped in glaucoma, this could help in thyroid eye disease management in future. Sir, we went for a lateral, deep lateral. Yes, sir. A lateral orbitotomy incision and a deep lateral wall decompression, and it was uniform across all 24 eyes.
In methodology, it should have been described in detail which type of orbitotomy was done. In demographics also, the male to female ratio, the preoperative visual acuity,
Yes.
the postoperative visual acuity, all these things should have been mentioned in your study.
Ma'am, the demographics and everything was mentioned, male, female, and visual acuity, but I just breezed through it because
that is important.
Yes, ma'am, it's important. Our median visual acuity was 0.1 logmar units, and we did not do a mean because most of them were 0, so our mean was coming out to be 0. So median was 0.1 with an interquartile range of 0 to 0.2 logmar units.
Was there any criteria related to optic nerve status on fundoscopy?
Yes, ma'am. We ruled out any patients who had an established dysthyroid optic neuropathy or an optic neuropathy or an optic atrophy due to any other reason. We had ruled those cases out. So we had taken vision, pupillary reactions, fundus examination, and as our primary parameters. We did not use color vision, contrast, and visual field.